everyone. Wow, we're back after almost a year, right? Like, yeah, and Sydney, you've been away. You went to...
I studied abroad.
Semester abroad. And you learned a lot. And now we have Lauren, who's joined us from Siena College. So why don't you introduce yourselves just briefly, and then we can go ahead and get started. I'm Dr. Rich, Susan Rich. And we have the Better Safe Than Sorry team for the summer here. We'll have a few other people coming and joining us from time to time, but and then we have Sydney.
I'm Sydney, and I'm a rising senior at Salisbury University, and I'm an intern for Dr. Susan Rich.
And I'm Lauren. I'm a rising senior as well in psychology at Siena College and a philosophy minor. And I'm new to the internship, and I love it so far.
So Better Safe Than Sorry, we've been doing now for about a year, and a little over a year. We had our kickoff at Churchill High School last spring to teach all 500 graduating seniors about the importance of thinking before you drink, not just about things like driving and you know, where you're at in public and not getting into fights, but also thinking a little bit about planning if you're having sex to protect yourself from getting pregnant. Because a lot of things happen before people find out they're pregnant. And so that's what our campaign is all about, teaching people the relationship between sex, alcohol, and fetal alcohol spectrum disorder, or ND-PAE. Do you want to tell them what ND-PAE is today?
It's the neurodevelopmental disorder associated with prenatal alcohol exposure.
And we just got back from Toronto, right, talking about that. We'll have a, one of our blog postings will be about our trip to Toronto, the upcoming one. And what were we doing there, guys? What were we doing?
So when we went to Toronto, we had a presentation about the effects of prenatal alcohol exposure, and we also attended a lot of talks about neurodevelopmental processes and brain development and things like that associated with emotion, and it's very interesting. Definitely learned a lot.
Yeah, we did. So it's for the American Psychiatric Association annual meeting, and this year it was held in Toronto. It's a joint Canadian and U.S. Psychiatric Association, so that's the American Psychiatric Association. And we made a lot of contacts there.
Yes, we did.
And one of the reasons for me going this year was putting on this symposium, which was the first time that we've actually presented at the American Psychiatric Association. They had another presentation on the Sunday before ours, which was on the Wednesday, that was done by a variety of people from the National Institutes on Alcohol Abuse and Alcoholism. So, I mean, that might be a good one also to link when we do our blog posting, just so that people can see that one. But I also had the opportunity to be recognized as Distinguished Fellow in the American Psychiatric Association. I'm hiding my, you know, sort of blonde roots so that people don't know my true age, right? But it was a real honor, and Lauren, you got to be there. And
yeah, and we met the president of the EPA, and we went to the meet and greet the night before, and then I sat on the convocation. It was wonderful, beautifully done, and it was a huge honor. She was one of 2 rows. There was only 2 rows of Distinguished Fellows, so
she skipped fellow.
Yeah, that was very cool, right?
Yeah.
Because of Roger Peel, you know, my good friend Roger Peel.
Right.
So the opportunity that we had to share with the American Psychiatric Association about this is, you know, really new for psychiatrists. You know, this is a very new thing. And toward the end of our talk, a number of people stood and spoke about this issue. And what was their response? What did you get from their response?
I got that they hadn't either no knowledge or very little knowledge of FASD or even any disorder related to prenatal alcohol exposure. And this was very new to them. They learned a lot, and they feel very strongly that the public and other psychiatrists need to know about this issue.
Yeah, and the first time I spoke about it to psychiatrists was in 2009. I took, I chaired a symposium, and I invited Dr. Ken Jones, who wrote the first paper on the topic in 1973. The paper was published in the journal Lancet. And that might be a good link for us to put. It was the very first paper, and it was about fetal alcohol syndrome itself. It's when they characterized the first maybe 8 to 12 cases. And he attended, and that was in Hawaii. He and Kathy Sulik, Dr. Kathy Sulik is my mentor from UNC, whose work went into the original Surgeon General's warning. She showed that this problem occurs as early as the late 3rd to early 4th week after you get pregnant. So that's before a lot of women even know they're pregnant. And then Ed Riley, Dr. Ed Riley from the San Diego State University Center for Neurobehavioral Teratology is where he works. And he went along with Christina Chambers from the University of California at San Diego. She does a lot of epidemiology. And, again, just to highlight this as an important issue that psychiatrists aren't really familiar with, but we see it every day of the week. And we never think to ask the women, what their use of alcohol was even before they found out they're pregnant. And a lot of people still think it's okay to drink when they're pregnant, unfortunately. Yeah. And then in 2011, we went to Toronto with the American Academy of Child and Adolescent Psychiatry. I took a group, and I chaired clinical perspectives. And then this last November, in 2014, I chaired a institute on the topic and then a special interest study group. So trying to get this more into the mainstream of psychiatry, because a lot of people writing about it, they actually write in journals that are more alcoholism and substance abuse related and less into the psychiatric field. So that's why a lot of psychiatrists don't really know about it. So now I went to present more like the overview and the new DSM-5 criteria. Sydney, you got to present as well, and then you, Lauren, presented a little bit in the panel on your perspectives. So tell me a little bit about what you felt getting up there and talking, and we'll put a link to your talk as well. But Sydney, what did you feel about all that?
Well, I was really nervous, but then I realized no matter what I say, these people are learning something because they're very, uninformed about this topic. So then I was more relaxed, and I got to actually teach them stuff. And someone even mentioned that they were very impressed with how people our age are very passionate and informed about issues like this, and how we are the future, and how we can help, spread awareness and prevention.
Right. The woman who spoke was impressed that we had incorporated young people your age, because you're what, 20, 21? And incorporating you into the development of Better Safe Than Sorry, because it's you who are seeing this every day of the week. We talked some about that in our other shows last year, how it's not uncommon to see girls getting totally wasted. I think one of you said that in your panel, in the panel presentation.
Yeah, people at school, in college, they drink they don't just binge drink, which is 4 to 5 drinks in one sitting. I had mentioned that some people have 12, and that's just to begin the night. And it's very shocking how much people our age are drinking nowadays.
So drinking 12 to start with.
Well, I think it's interesting because when Sydney was presenting, I was sitting next to Bonnie Buxton, who also joined us at the show and at the presentation, and we were commenting to each other when we were talking about the statistics of college drinking, and seeing her perspective versus mine it was eye-opening, because to older generations, they may not. Times have changed, definitely, and we see it every day. It's just part of the college culture, is the way that people drink, and it's very prevalent, and it's shocking, I think, to people who aren't in that. I mean, it's really even shocking to us. So
Oh yeah.
I think that getting our point of view is very important because this is the population you're targeting with Better Safe Than Sorry. You want college-age women, childbearing age women who drink to be aware of this. So it's important to have these people presenting because we see it, you know. And I think when I got up there to talk quickly on the panel that it was really just a great feeling to be able to talk at something as exciting as the APA conference. But also it's important to have the younger generation's point of view as well, you know, because they hear the same, not the same thing, but they hear from the same people, and it's important to have new perspectives, and that's why your talk is so good because you're fiery, so people listen, you know, so it's important to bring a new perspective. People, it catches people's eyes, I think, so really liked it.
Yeah, well, you know, the one thing that I think impressed me was the fact that we had someone there who is really a luminary in the field. His name is Dr. Carl Bell. Do you remember meeting Carl Bell? We'll upload the picture that we got with him and me and Roger Peel. It was really an honor. His work had come out earlier this year in Psychiatric Services, the journal Psychiatric Services. Do you guys remember what his work showed?
Well, that 40% of people coming for psychiatric care in Chicago,
Southside Chicago,
showed symptoms of fetal alcohol exposure.
Right, so he showed that if he used the criteria for neurodevelopmental disorder associated with prenatal alcohol exposure, that 40% of people coming in for psychiatric care at a clinic, a family medicine clinic, they're coming in for psychiatric care, 40% have some, well, not just some degree, but he could diagnose them with ND-PAE and not the things that they had previously been misdiagnosed with. So do you remember what some of those were?
Probably ADHD, ODD,
Autism, bipolar disorder, schizophrenia here or there, I'm sure.
Oh.
Because, you know, again, this is a problem of brain wiring, and it messes up the neurotransmitter systems, and it causes people to look like a variety of different psychiatric conditions.
Right.
And some people would say, oh, you still would want to diagnose them with ADHD. And my feeling is they're going to respond differently to the medicines. Their heart might have an underlying conduction anomaly, which is common in this population. They may have an underlying seizure disorder, which is common in this population. You want to be really careful about use of certain kinds of medicines with them. Their metabolism, a lot of times I've seen different because of their genetics. The serotonin transporter and receptor sometimes are different. You know, psychiatrists deal with this every day of the week, and they don't understand why certain patients respond to certain medicines and others have paradoxical reactions with a lot of side effects. But I feel like if you start looking at this population as prenatally exposed to alcohol, you're going to have a better understanding. And that's why I've been so passionate about getting this out to psychiatrists.
Well, people say, why diagnose them with ND-PAE? They're already diagnosed with ADHD. They're already diagnosed with this. The problem is when you're misdiagnosed, who wants to be misdiagnosed in the first place? Because you want to know what's wrong, you know? And if you know what's wrong, then you can treat it better. So the population of ND-PAE, they don't respond as well to treatment methods that people with ADHD or autism or things like that have, and that's why the treatment models aren't being effective. And that's why when I was at my RTC from January to May of this past year, I saw revolving door of these children coming back and back for treatment because the typical RTC model doesn't work for children who are exposed prenatally to alcohol, and not one of them was diagnosed with ND-PAE, and there's a good chance that they very well could have been exposed prenatally to alcohol. So yeah, they could be exhibiting symptoms of ADHD now, but the cause of that is different, and because the cause, the wiring is different, the treatment isn't going to work for these children. They need more directed care, one-on-one model. They're very concrete thinkers. They need step-by-step care and step-by-step directions to understand, and that's not what I saw. You know, and special education is a lot different. They need different educators to target. So when you put them in a treatment center with kids who aren't prenatally exposed to alcohol and you give them a blanket treatment model, it doesn't work. And they leave 20 to 30 days without any change, and then they come back in a few months. And it's just heartbreaking because these kids are going to end up in the juvenile detention center when they're older, and it's going to be just a downward spiral from here on out. And they're so young, so there's so much hope for them, but
Yes.
it was very upsetting.
Yeah, there is hope, and I was very impressed with the fact that you were able to bring that fresh information in straight from the trenches, where you didn't know anything about this problem when you were there, and you were seeing it, and you said, why are these kids why do they keep coming back? I don't understand. Your program isn't working for them, obviously, but you keep doing the program as though it's going to help these kids. And how many dollars do you think are spent
Incredible.
Really, on a daily basis to help the kids, and they're not being helped? I see that as warehousing them for 30 days, and then you put them back out. They revolve back through the system. You said that some of the kids were bragging how many times they've been there.
Yeah,
Because
like 5 or something.
They're just too young. They don't understand what it means to be there. So I remember I'll never forget one kid, this is my 5th time here, that another girl said, she was older, around 12. She was on the higher end of the age, but I was here in January and it was February. So, and I just met her and it was it was January, and she had just been released before Christmas. So it's just they're not old enough to understand the impact of what that means, and some of them are hospitalized, and it was a broken system. It wasn't working, these kids would just leave in 20 or 30 days to make room for a new kid coming in. So there was a waiting list, and it was just, if you can target the treatment outside of these centers, or even when they're in there, really try to make their time effective rather than just keeping them stable from that time and keeping them away from, it was really like a respite care from home and school, and they weren't being handled at home, and it was just very upsetting. And so I did a research project on the treatment effectiveness of RTCs for disruptive behavior disorder, and I found that after the first year post-discharge, 32% of children were meeting criteria to be back in an RTC, and after the third year it was 59%, which is that's over half, so it's not working. So something needs to change,
Right, and disruptive behavior disorders in general, that's a whole hodgepodge of many different kids.
Yeah.
It's,
many different disorders.
And many different disorders. And in my view, when a child comes in and I know that they were prenatally exposed to alcohol, I start with, okay, do they meet criteria for ND-PAE? And if they do, then I have a treatment model, a 4-domain approach that I help the parents understand, okay, these are the areas where their weaknesses are, and they have a lot of strengths, and let's look at the strengths and let's help start building from the strengths into some kind of fund of knowledge and a vocational experience for them, like say they get to be 11, 12, 13. Let's get them involved in something that they can feel good about themselves outside of school, as opposed to like being in the rigors of the school system and being asked to do the higher level math and science and things that maybe their brain's not equipped to do. But they would do fine in a little bit more structured classroom setting, and then with outside activities to enrich their overall experience.
Right. I just remember in the books that we've read, they just keep mentioning, why does it matter if there's a diagnosis for ND-PAE, that it's not like there's any treatment. Well, you're wrong. If there is stuff like this, like having them diagnosed at a young age, nurturing them into a very structured and loving environment will, bring them up to be successful. Maybe not in the same way as, a kid going to Harvard, but being very successful for someone with a disorder like theirs.
Right, and recently you guys have attended, various different things. I know last year, Sydney, you did, and this year a couple of IEP meetings. And you attended maybe 1 or 2 last year with me, but mostly juvenile delinquency, kind of forums. What would you guys say that you believe telling parents would be helpful like as far as educational systems, advocating, that sort of thing. Do you have any ideas about that?
Very, very structured environment. Like, we read Mary Green's book.
Yes.
And in that, you know, he was in a very structured residential living school, and that helped a lot.
To put those systems in place. Now, again, her son was adopted from Russia, and you know, likely had, you know, a lot of traumatic experiences in the orphanage. And then once they got him, you know, because he's very impaired, and her book is When Rain Hurts.
Right.
We had reviewed that one for our blog. He was very impaired, but you know, they gave him a lot of love and a lot of support, and thinking that, okay, he will grow out of some of this, but it really doesn't work that way, and they had to actively pursue systems of care, you know, even above and beyond what was being offered, to the point that I believe you know, they had to go through a lawsuit with the state of New York to get services for their child. And for parents to have to go through that is, you know, how many parents have the resources to do it? And if you get a child from an inner city, like we're hearing from Dr. Bell, you know, 40%, how many of those parents are going to be able to afford those kinds of systems? So we have, you know, we've come back from Toronto. We're going to be heading out to, Vienna later this summer to speak at the International Congress on Mental Health and Law. And in the meantime, NOFAS has their upcoming gala for all of their affiliates, the National Organization on Fetal Alcohol Syndrome. And Bonnie Buxton and Brian Philcox, I always want to say Phil, but had won an award last year for their life's work on the issue. And you had gone with us to that, Sydney. They're coming into town, and we're hoping to be able to meet with them and maybe do an interview. We stayed with them, and we were so grateful, right, to stay.
So lovely.
They were wonderful.
Yeah, they opened their home to us while we were in Toronto, and it was such an amazing.
They're very fun.
They're fun.
They are
very fun people.
Very fun.
And Canadians are fun, aren't they? But Canadians have a lot more, I feel like, understanding of this issue and putting better systems in place than we have in our country. And a lot of it is the differences between their system of medicine and the fact that they're a little bit more socially minded. I feel like socially responsible just in general. Canadians are.
They're above the game.
Yeah.
Yeah, above the game?
Yeah, they're ahead of the game.
Yeah, ahead of the game. Yeah, exactly. So, well, I'm looking forward to the next time. What are we going to talk about the next time? Do you guys have any ideas?
Damaged Angels.
Damaged Angels. Okay, and now, but they're not coming until like 2 weeks from now. So what are we doing next week? What will we talk about?
We can talk about, I remember last year, you know, we have to do our research, but there was always articles like the one on Alaska Initiative.
Yes.
Or the article about the woman who thinks that you should take back your pregnancy and drink. And
oh, right. Yes, yes.
And I think that if we
so
dig
Lauren's
deep
not
enough,
aware of this. Okay, wait. I'm saying that, Lauren, you need to get Lauren up to speed on this.
there was this woman who thinks that they should be in control of their own pregnancy and be able to drink if they want to drink, and it's, you know, their choice and stuff like that. And we reviewed that on the talk show, and
it's called Take Back Your Pregnancy. She's an economist from I don't know what.
She's an economist.
Yeah, she's an economist. She's a master's in economics. It's not. She didn't go to Harvard Medical School.
Yeah.
Okay, let's put it that way.
Right.
And she wrote a book, Take Back Your Pregnancy, and it got a lot of support and publicity through the Wall Street Journal and many other national newspapers. And although many of us tried in the FASD world to write rebuttals and editorials, you know, nobody would publish it. Letters to the editor, that kind of thing. because, you know, she's essentially saying, oh, she's reviewed like 3,000 journal articles. I don't think girlfriend can read 3,000 medical journal articles. Okay, she's an economist. But she's saying that she reviewed all these articles and that she believes it's okay to drink. And by the way, go ahead and, you know, use caffeine. I want to get back to my caffeine here, is what she's saying. Yeah, literally.
Wine and caffeine.
Wine and also shellfish and like the, okay.
Like all the things you can't have.
Right, and she's like, mercury is not that big a deal.
Oh my goodness.
Big game fish. I want to go ahead and, why can't I have my fish? And it's like, so the interns were like, you know, this woman is so selfish. Why can she not stay away from this? And what we've uncovered is actually that there is information showing that even fathers who drink, and even though it's not, you know, the data isn't clear enough for people, you know, all the scientists to go out and publish, you know, widely in the lay press, there is evidence that it causes epigenetic changes in sperm, and that this would last for generations. And just like the literature that I talked about at the APA in guinea pigs, all the way back to the early 1900s, people were doing work in guinea pigs showing that, you know, generations later, even if it was the great-great-great-grandfather exposed, you know, his sperm were exposed and then the babies developed, that generations later you would still see effects. And so men aren't immune to this either, and I feel like if you can't stay away from it while you're trying to get pregnant for those 3 to 6 months, and during the pregnancy itself, and during lactation, you got a problem.
Right.
Like what is, I just don't get how important alcohol is. Like why do you guys think? Like why is it such a draw for people?
Well, that I don't know. When I was abroad, you know, people were talking about, you know, the second we get off the ship in port, like, we're going to go drink and do this and that. And I'm like, I can be completely fine not drinking for 4 months.
Yeah.
Like, and, you know, it's not like I'm planning a pregnancy or anything like that. And I just don't feel the need to. And what Brian said really, really, I think, you know, hit it home, and it was just very, very, very smart. He said that he was at a high school or a school and giving a talk, and he asked, you know, what is planning a pregnancy? And they said, you know, when you're pregnant. And he was like, or when you want to have a baby. And he was like, no, if you're having sex unprotected or whatever, and you're drinking alcohol, that is planning a pregnancy.
Yeah, well, if you're having sex and not contracepting, that is planning a pregnancy. A lot of kids, what happens, they, just like you guys have said, use alcohol, and they end up so drunk they don't know what they're doing, and they get taken advantage of, or vice versa, and they end up having a pregnancy and not knowing it, and then 3-4 months later they find out they're pregnant, and they've been doing the weekend binging for however long. And if they're, you know, a college student, it doesn't, this kind of behavior doesn't end in college. We talked about that, right?
Yeah.
Like these behaviors start in high school.
They grow through college, and then they really just stay the same.
When they get out of college,
Yeah.
they're still going out partying. They may be working, holding down a job, but they're going out having the same drinking behaviors.
Great.
And 13.5% of women binge drink during reproductive years. 13.5%. And you're saying that you think it's higher.
I was just gonna say, it's higher than that.
It's got to be higher than that, because
College campuses, right?
Yeah, well, college campuses, and like, people are drinking, you know, 12 drinks a night at least every freaking night of the weekend, every single weekend of the year. It's gotta be more than 13%.
If you look at just college age
Yeah, it's got to be more.
It is.
Yeah, and that's why the CDC has really focused a lot of effort on college-age women, and they're saying that this is a huge issue.
So when I presented, they had statistics on a percentage of 9th grade, a percentage of 10th grade, a percentage of 11th and 12th graders who binge drink. I just remember the highest being either 63 or 68% of 12th graders binge drinking.
And it was around 40-some%, I think like 43% of ninth graders binge drink. Okay, so
I think it was like 48%.
Yeah, 48%.
Closer to 50%.
Which is a lot. So that means you have to start when they're way younger. So when I give talks at Wayside for Career Day, Wayside Elementary is our local elementary school every year giving talks, and I talk about, healthy habits. It's just like a dentist who might go into school and talk about brushing your teeth and flossing so that you don't end up with cavities in your teeth. In my view, for child psychiatrists, and there are only 8,500 of us in the country, we need to be doing more prevention by going into schools and talking about the fact that alcohol can cause holes in your baby's brain even before you know you're pregnant.
Right.
And it can disrupt brain development during adolescence. It causes, with the brain wiring that's going on in adolescence, it causes the stem cells that are going to help with the reorganization of the brain to actually not be able to do that. And it's the cells you use that you lose. But during that period of rapid brain growth, you put alcohol on top of it or other substances, other drugs, and you're going to end up with brain damage rather than you thinking, oh, it's just like partying and having a good time. It's actually damaging your brain. So helping people think about this ahead of time, I think, would be good. And I'm glad that you guys are with us and you're with us for the summer to figure out how to get this out to more people.
Right.
How to spread the word. So we redid the blog. You guys have done that. You reorganized the blog, and we're going to start putting more kind of posts on, maybe doing a newsletter, that kind of thing, and spreading the word at your colleges amongst the various fraternities, sororities. You did that last year, Sydney, at your school. And Lauren, you'll have more chance to do that at Siena. And so next week we'll come back and we'll talk about
any articles we can dig up on these things. I'm hoping that there's no more articles like Take Back Your Pregnancy, but we'll find out.
Well, we'll find out. And in the meantime, we will we'll all be busy, and then we'll come back together at some point next week.